Welcome to Catalyzing Change Week. This year's Catalyzing Change Week is about solutions from the front lines by social innovators.
In 2022, Catalyst 2030 concentrated its efforts on bringing proximate leaders and frontline solutions to the forefront. Collaborations led by members from the Global South produced groundbreaking reports on climate and transforming education, with an emphasis on offering local solutions. We continued our mission to create an enabling environment for social entrepreneurs to flourish by initiating a letter to donors, signed by more than 1,200 social entrepreneurs and innovators. The Catalyst 2030 awards ceremony was spectacular, and the awards themselves welcomed by the private sector, governments, bio multilaterals and donors.
Catalyst 2030 as a movement is disruptive.
One of the best things I think that's come out of Catalyst 2030 so far is incredible collaboration across the ecosystem that just didn't exist before Catalyst came into being.
The thing I love most about Catalyst is that it's an open movement for social entrepreneurs around the world.
I'd encourage anyone who's looking to be more connected with their local communities around social development goals to come along to Catalyzing Change Week.
Welcome to Catalyzing Change Week.
Welcome, everyone. Over to you, Nalini.
Thank you so much, Lena. Good evening, everyone. It's really great to have an opportunity to showcase some of our work at Catalyzing Change Week. So thank you to the Catalyst 2030 leaders for making this happen and for giving us this opportunity to present our work. I wanted to talk for a few minutes about why collaboration is the need of the hour to advance India towards meeting the Sustainable Development Goal number 3, which is to do with health for all at all ages. So if you look at the post-COVID era, India is has made remarkable progress on poverty, but still India has the most number of poor people. And this is poverty as defined in a multidimensional way, taking consideration of health, education, as well as standard of living. So if 250 plus million people in India are poor, and we are actually ranked quite low on the hunger index as well. So we really are, have a long way to go on the development agenda. Let's just examine health. Health for us, has traditionally been maternal mortality, under 5 childhood mortality, infectious diseases, and, including COVID. But of late, and COVID brought this to the forefront, of late, the non-communicable diseases like diabetes, heart disease, chronic lung diseases, and cancer, and also including mental health, are becoming the defining challenge of our generation. This is the reason why all the progress the world made against the Millennium Development Goals can be wiped out. And if we don't address NCDs, non-communicable diseases, we won't reach the SDGs. So it's very clear to all of us in this sector that we must address NCDs. NCDs, if you just look at diabetes, which is one of the non-communicable diseases, 2 out of 3 people are dying from NCDs, but in the case of diabetes, 3 out of 4, up to 3 out of 4 people in cities in India are either diabetic or pre-diabetic. Okay, how do you manage, or how do you take care of a disease that is affecting 3 out of 4 adults in the city? It is really difficult. It's a huge challenge. You cannot give enough medicine, distribute enough medicine, make it accessible for people who need it. So we really have to come up with something that is a solution at the population level, and that is prevention. Fortunately, all these diseases, these non-communicable diseases, are preventable to a large extent. So 80% of heart disease, 80% of diabetes, and 40% of cancers can be prevented with 3 lifestyle changes. We must eat right, exercise, and avoid tobacco. So that prevention is the smart solution, is what is at the core of all Arogya World's work. I founded this nonprofit called Arogya World 13 years ago, and we are focused on that. So, the opportunity for collaboration exists now. COVID again showed us the importance of prevention and the importance of addressing these non-communicable diseases. People dying from COVID are generally people with underlying non-communicable diseases, making prevention of these NCDs more urgent and important than ever before. We have at least 3 programs, Arogya World programs, that are right for collaboration, and I do want to highlight a couple of those. And we'll go into detail on one of them a little later. So education NGOs that are focused on, literacy and education throughout the country, and there are many of them, cannot afford anymore to just focus on education. Health NGOs cannot afford to just do their agenda, to just advance their agenda. We must collaborate. Just to give you an example, Arogya World has a school health program that teaches 11 and 12-year-old children about healthy living through games and activities that are age appropriate. In order to deliver that program, though, at scale, we need partners. We need people who are trusted by the school community, people who, are in the education field, who can take our program, if we can train them properly, can take our program and deliver it at scale in the community. So that collaboration is a very smart use of resources between NGOs, all focused on that adolescent child and making the next generation lead a more productive and a healthier and more fruitful life. So that is why the collaboration is very, very, very important. The other one I want to bring up is a session we had yesterday on Arogya City. So that's a multi-sectoral collaboration in Bangalore that is showing promise. 22 organizations, small and big, companies, colleges, civil society organizations, all joined hands to make public pledges to improve the health of certain number of Bangaloreans. And I think together it'll be 750,000 or 1 million people that we would have helped together. So that's another way of, sort of putting a small investment, driving that multi-sector collaboration, getting people committed, showing, the world what is possible when a small group of committed individuals can get together. And the third one that I want to highlight, which is one we'll delve into a little bit more, is on our diabetes program. So we have a text message program that has now become adapted to WhatsApp as well as voice messages, which teaches, sends messages to motivated individuals who sign up about diabetes and its prevention through healthy living. It's a series of 56, 57 messages that's sent twice a week over 6 months. The mechanics, the proof of concept, we've shown 20% improvement in multiple health behaviors because of that diabetes. So Arogya World can do the message transmission and the project management and even impact evaluation. But what we can't do is go into the communities and get people to opt in and sign up. For that, we need on-the-ground partners. So when we share resources, which is frontline workers and trusted community partners, as well as content and impact evaluation from someone else, then it's possible to do this, this kind of collective effort and make a difference. So I really do believe that we have an opportunity to collaborate in meaningful ways. And for that, I We got a modest grant from Catalyst 2030 to test this M-diabetes on the ground collaboration. And to tell us more about that and to have a conversation with our two partners, one in Jharkhand and one in Karnataka that have signed up with us, over to Meeta Walawalkar, my colleague who's in charge of community programs in India. So Meeta, over to you.
Thank you, Nalini. Good evening, everyone. Thank you, Nalini, again for setting the pace, telling us about the importance of NCD education, the importance of collaboration. So let me directly jump into this particular project, M-Diabetes, in collaboration with the Sathya Sai Hospital. Before I get into the details of the program, I would like to invite my panelists, Dr. Panindra, who takes care of community medicine at Sri Sathya Sai Sarla Memorial Hospital, and Dr. Anuradha Sunil, who is the director at Indian Society of Healthcare Professionals, ISHP. They are our partners as well. And finally, the third panelist, Varun Rameshan, my colleague, who takes care of M-Health projects in Arogya World. I welcome you three. So to give you a little bit of, sort of initial thoughts around this project, the project is up and running. People have been enrolled. People have started getting the messages on WhatsApp. So Varun, I would like to ask you, first of all, briefly tell us about this program and the project. Then tell us what is the role of Arogya World here, what are we doing, and how is it going currently?
Thank you, Meeta. Before I get into, as Meeta said, before I get into telling everyone about what is really happening on ground with the project in Jharkhand and Karnataka, I'd give you a context about what is M-Diabetes and why we do M-Diabetes. So M-Diabetes was designed as a population level nationwide public health intervention using mobile technology to establish health behaviors known to prevent diabetes. The big NCD problem, Nalini has already spoken about, but again, I'm going to just give you a few data points. So non-communicable diseases, which include cardiovascular disease, diabetes, cancer, and chronic lung disease, are one of the 21st century's greatest health and development challenges. And NCDs cause 7 out of 10 deaths today, 6 times as many deaths as HIV, AIDS, TB, and malaria combined. And 77 million people formally diagnosed with diabetes in India, which makes it the second most affected in the world. And by 2045, we are set to become the diabetes capital of the world. So the basic premise on which our program was conceived is that 80% of heart disease, 80% of diabetes, and 40% of cancers are preventable with 3 lifestyle changes: avoid tobacco, eat healthy foods, and increase physical activity. Our flagship effort in 2011 to 2013 was done with Nokia Life, where we reached out to more than 1 million Indians. And this groundbreaking effort, we sent 56 text messages to more than 1 million people about diabetes and its prevention in 12 languages twice a week for 6 months. So our program comprises of 56 text messages, which are sent over 6 months, and each person gets 2 messages per week. And the program's effectiveness, be it in any context, is always tested in understanding what sort of behavior change we have been able to introduce. So the study, the project that was done with Nokia came out with a paper which was published in Northwestern University and was a collaboration with other top researchers in 2016. And it showed that there was more than 20% improvement in multiple health behaviors, which Nalini earlier mentioned. Since then, since 2011, 2013, we've worked with stalwarts in healthcare such as Google, Arvind Eye Hospitals in Tamil Nadu, LV Prasad Eye Institutes in Telangana and Andhra, Lions Club in Bangalore, Ambuja Cement Foundation in multiple states. And in all these places, we are trying to promote healthy living to prevent diabetes. So now moving on to what is happening in Jharkhand and Karnataka with the 2023 M Diabetes project. So with the support of Catalyst 2030, we've rolled out M Diabetes on WhatsApp for 2,600 people in Jharkhand and Karnataka. Originally conceived as a program on SMS and IVR, owing to the many dynamic and interactive features of WhatsApp and the increased usage of WhatsApp and smartphones in India, the M Diabetes WhatsApp bot holds great potential in creating greater impact on users. So in Karnataka, we've collaborated with Sri Sathya Sai Sarla Memorial Hospital in Chikbalapur district to reach out to semi-urban communities located on the fringes of Bangalore city. With Sri Sathya Sai Sarla Hospital, Dr. Panindra and Ashimovo have been of great support and guidance in rolling this out in their communities. They have been with us throughout. Similarly, with YSAP Foundation, we are reaching out to rural communities in Bokaro, West Singhbhum, Saraikela, Koderma, and Gumla districts of Jharkhand. Here, Soumya and Dr. Anuradha have been with us on this right from the start and still are supporting us throughout the enrollments. So this time around, now going on to the technology side of things, this time around, we've developed this chatbot in partnership with more than partnership, with the support of Glyphic. So Glyphic is an organization which helps not-for-profit set up this WhatsApp bot. So from setting up our app on GovShop, designing the conversation flow, getting template approvals from WhatsApp, creating a dashboard to monitor user engagement with messages, all of these key steps involved in chatbot development was done by Arogya World. And also another very important thing in terms of technology that I want to mention is that Arogya World is the proud recipient of Meta's waiver, which allows us to initiate 1 million conversations on WhatsApp per month. And I believe it provides a great opportunity to that we should leverage to impact as many individuals across the length and breadth of the country. So with the chatbot ready, we immediately moved our focus to implementation. And the first thing when we look at implementation is capacity building of frontline workers of both partner organizations. So online training was conducted by Nidhi Jaiswal, who's joined us on call. Nidhi is the director of M&E for Arogya World, and along with Nidhi, we conducted detailed trainings on why, who, when, and how of implementing M diabetes in the community. Along with that, we focused on key roles and responsibilities, do's and don'ts of conducting survey and WhatsApp opt-in. And we also provided a manual which was handy to these frontline workers. So once frontline workers started with enrollments and survey, real-time monitoring of each frontline worker's progress was carried out by us. So this helped us ensure that we were adhering to the timelines we had agreed upon. And overall, the WhatsApp platform helps us understand user engagement with M diabetes messages on a detailed level. And I believe that this helps us enables us to maximize impact. And therefore, going forward, WhatsApp must be the preferred medium of delivering these diabetes prevention messages. So if I was to give you an update on where we are with enrollments, we've completed, we've almost completed enrollment of 2,600 people. We have almost a dozen people remaining in Jharkhand, and that's about it. So today we will be closing enrollment, which is a great achievement. And I want to congratulate both teams who are present here. It has been not so easy, but definitely we've achieved it in the time that we had decided. So that's great work.
Wonderful.
Yeah. So thank you to both partners. And now another key aspect of M diabetes is assessing program impact. All programs, wherever we roll it out.
Yeah, I was going to come to that, Varun. You know, why WhatsApp and how is that, a preferred, you said it's a preferred mode of delivery now. Why is it a preferred mode of delivery over SMS and IVR or other OBD? If you can quickly summarize that so that we can go to the next questions.
Yeah, sure. So WhatsApp as such is Definitely, before I get into the benefits of WhatsApp, you can definitely say that SMS and IVR would cater to a group of people who do not have access to this application. But now what we see is there are 900 million people who have smartphones in India. There are close to 500 WhatsApp users in India. So WhatsApp penetration is slowly increasing, and WhatsApp is a much more dynamic and interactive platform than your regular SMS and IVR. So what we have seen over the years is that somehow WhatsApp has the ability to capture the user's interest in the program more than SMS and IVR with its interactive features. And the way of collecting certain metrics is also allowed through WhatsApp in a better way than SMS and IVR. So for example, we are implementing a baseline and endline survey through WhatsApp. And on a monthly basis, we are also taking stock of two indicators, which is physical activity and
yeah.
Yes. Yeah.
Yeah, I think we got the idea. Thank you, Varun.
Yeah.
So we see how passionate our team is about this program. Varun is completely involved with this project. Thank you, Varun, for that. And congratulations that the enrollments are almost complete and all the recipients are getting messages. I would like to invite Dr. Panindra. Dr. Panindra, tell us a little bit about your organization and the region that you work in. Were there any difficulties in enrolling people to onboard them onto the program, be it for you or your frontline workers? How did you overcome them? How many frontline workers did you deploy on the ground? What were the overall challenges, if you could tell us?
Okay, thank you. Firstly, my apologies that I'm in a public transport bus and I'm not able to switch on my video due to some unexpected travel. Initially, when we discussed this project with Nalini Madam, we thought there would be a lot of challenges, but it didn't seem to be that challenging when we started working on the ground. This is for two reasons. One is that we were not really sure as to how many people would have smartphones in villages. But thanks to COVID, that most of the people now, even in villages, though we think they are poor, the smartphone is not like a luxury for them, but a basic necessity for life. So finding smartphones was not a problem. The second thing is, we were not really sure how people would respond when we go and knock on their doors to give some health education. Because most of the people are keen on getting something like a product in hand. It could be even a chemical or a pill that can bring down your illness or something like that, which they'll be willing to take. But when you want to go and advise and tattoo at their own doorstep, we were a little skeptical as to how people will respond. But surprisingly, there was a wonderful response from especially the youth and the adolescents who were in their houses. So when we were talking to the youth of the houses, the small children and adolescent girls and boys, they were very keen and they were asking so many questions to our frontline workers. And this led to a great kind of a revolution even amongst our own staff. We deployed around 15 staff for this recruitment of subjects in the nearby villages. And most of the staff were asked many questions as to what is diabetes and how we can prevent it. Sadly, the situation is that all the food items that are leading to increased sugars and all high glycemic food items have become very cheap these days. and they also are they're cheap and tasty. So if I have to find 10 gram of protein which is tasty, it's very difficult for me to get it in less than maybe 30-40 rupees. But I can get something which is very tasty at the cost of 2 rupees. One of our frontline workers, he came with a wrapper of a chips packet which was costing only 1 rupee. Very nicely packed, very shining wrap, kind of a chips packet, which is just costing 1 rupee, which has reached the last kilometer in the country. So this was one of the shocking revelation, and but of course people are very curious to know how to prevent diabetes and what is the lifestyle measure that they need to take and all that. So, and there were also some frontline workers who work for the government in the villages, like ASHA workers and Anganwadi workers, who were also curious and were asking if incentivized for doing this work and if they can be involved in this work. So this is
That's
again a
wonderful.
welcome move. Yeah, but again a welcome move for our expansion. And one of our frontline workers, he came to me and told that this whole exercise, what we are doing, could be done even more easy in an easy way by having displayed a contact number where people by themselves voluntarily get to give a missed call, and that itself activates this chatbot messages. So he saw this facility in a hospital for a mother and child related health education. So that was again done by another NGO called Noora Health. So every day a message on what to feed the child and many such aspects keep coming. I also registered just out of curiosity. So very interesting messages and very timely and useful messages are being sent. So
Yes. Thank you for
these
that,
were
Dr.
the feedback
Panindra.
from our field.
Yeah. It's good to know that Asha Anganwadi workers are curious about this project and want to be a part of it. Yes, there is. It's very easy to switch on the missed call activation. Yeah, so although this is a limited number of people program, but yes, that is also on the cards. It's great to know that youngsters of the family are interested and are sort of encouraging the older members of the family to enroll into the program. That's wonderful to know. Now, this was a perspective from Dr. Panindra, whose area is Chikballapura, which is outskirts of Bangalore, which is, you can say is a semi-urban sort of area. Now let's hear from Dr. Anuradha, who, from ISAP. They are our partners and they are rolling out this program in Jharkhand. Now, which is primarily a rural area. So, Dr. Anuradha, I welcome and invite you to tell us about your organization, your role in this program. What is it that your team is doing? What was your target? How did you achieve it? Was there any stumbling blocks, hurdles? How did you overcome them? How many frontline workers did you deploy? And what did they have to say about the program? Dr. Anuradha.
Thank you, Meeta. I have Soumya here from our organization, who is leading it from the front, coordinating and working very closely with Arogya World team and also the frontline workers in Jharkhand. Our organization is a 20-year-old organization, in fact, 23-year-old organization. We're working in healthcare, women empowerment and skill development and many other areas. We are working extensively in Jharkhand and more than 18 states of India in various sectors that I mentioned. So when this opportunity came up to work with Arogya World, we were really delighted that we are being a part of such a good project. And as we all know, India is not just one India. We have so many states and each of them having different, their own cultures and characters and whatnot. So, Chikbalapur has a different character. The southern states and Bangalore, they are more, progressive states, I should say, or healthcare infrastructure is much better, whereas, some of the states are lagging behind, and Jharkhand being one of them. So there are a lot of international donors who are working in Jharkhand state. And some of the districts that we are working are, Naxal affected areas and predominantly tribal population. So there are, different kind of challenges that we face, when we are launching any healthcare initiative. So fortunately for us and the frontline workers, we have been working in these areas, and a lot of them are from the, from the local areas, or they belong to the community that we are serving. So the challenges that we faced in Jharkhand was, it is a technological product. This M diabetes has a lot of tech component in that. So this particular areas that we talk about, there's a lot of scam that goes on. So, people are very reluctant to click on any links. So initially we had these kind of problems that, they were not willing to, they were not trusting us, and they were not willing to click on the links that, who are these people and why are they coming and asking us to click these links. And also, I must say that the lifestyle diseases, they are asymptomatic for a large part of the illness progression, that, until they become symptomatic, they don't, even the well-educated cohorts, they don't take it very seriously. And especially the tribal belts and, the rural populations, they always want to think that, they will not get any diseases. So these are some of the challenges that we faced. And, we adopted a couple of strategies to overcome these challenges. One of them being that, we deployed the local frontline workers, who are a part of the community, who understand their culture, who understand the context, the local context, and they speak the same language, they look the same, they speak the same language. And they were able to kind of, at least connect with them in the initial parts. And regarding the scam part of it, the suspicion or the mistrust part of it, we had to do multiple follow-ups, reaching out to them that, we are genuine people, we are not fly-by-night operators, and, they can trust us. Kind of, trust building took a lot of time for our frontline workers. So, and also, they had to kind of, talk more in detail about diabetes and, how it can help them lead a healthy life, and how that can improve the overall quality of their life, which is beneficial for their, the holistic well-being kind of a thing. So it took, more than few visits for our healthcare workers to enroll. So that is where there was a bit of lag in enrolling. So I think, which is normal given the area which we are working in, and also we're trying to reach out to the the real hinterlands of India with a tech product which is promising to be providing a healthy lifestyle for these cohorts. So thankfully we are almost near the goalpost, and I think today or tomorrow we will be completing the enrollments. And I think it is an achievement in its own sense that we were able to convince this difficult cohort to enroll into this project. And coming to the frontline workers, we have around 20 frontline workers working on this project, and each of them having to do 60 to 70 odd enrollments. And as I said, we are almost towards the success points. And anything else you have, any questions, then Soumya is here to answer.
Sure. Thank you very much, Dr. Anuradha. So here are two perspectives, one from the rural areas of Karnataka, the semi-urban rural areas of Karnataka, and the other from Jharkhand. And you see how different these two stories are. So as Dr. Anuradha said, India is not one country, but many countries in one. So moving on, my next question to all three panelists is, what do you think are the critical success factors for this sort of a project? from your perspective? Any one of you can answer that. What are the critical success factors according to you?
Okay.
Dr. Anuradha,
Yeah.
Varun, Dr. Panindra, yes, go ahead.
I wouldn't look at it as a, summative kind of, success points, Meeta. Like I mentioned, for us, even enrollment is one stepping stone towards success. Getting these people to understand that, there is there is a potential risk of diabetes, even though you believe that you're leading a healthy life and you're living in natural circumstances, and as per them they are eating very healthy food. Still, getting them to understand or creating awareness about diabetes, that you're also at the risk of developing diabetes, that itself I would count as one success point, critical success point. And then getting them enrolled into the project, and some of them have expressed their happiness that they got onto this program, and out of all the the people in the community, and we chose them, or somebody was there to reach out to them who has their best interest in their mind and their healthy lifestyle in their mind. So that again is another success point, and rest of the success points we are yet to see as we go along in the project.
Okay, great. Thank you, Dr. Manrada. Varun, you have anything to say about the critical success factors?
Yeah, so I'm just going to second what Doctor just mentioned. So what I've seen in projects in the past and in the current one is that the frontline workers have a great power in their hand to develop that stake in such programs among the members of the community. So they are literally eyes and ears on the ground, and as long as they understand the program and convey it in the right way to the community, that helps in the success of the program a lot. So I think that's a critical thing, and I think we have seen that stake being created in both areas in Jharkhand and Karnataka through our partners.
Great, great. So even a technology project like this, you're saying, at some point, the ball stops at the frontline workers and their understanding of the project. Wonderful. Okay, Dr. Panindra, do you have anything to say about the critical success factors?
Yes, ma'am. So the same thing like what I mentioned a little while ago is that having people to opt in voluntarily in place of a frontline worker going and doing it. So this is, I think, something very critical in implementing a project like this at a more larger scale. Like placing this kind of a mobile phone missed call concept at a very critical points, like a diabetic clinic or emergency wards where people wait for consulting doctors. So these kind of places, I think, would go a long way in making success for this kind of a process.
Great, great. So that's another perspective for us, where Dr. Panindra is saying we take away the dependency on the frontline workers, put up the phone numbers, let people give a missed call and enroll into the program. So that's wonderful. That's another way of really scaling up the program. So thank you to all the three panelists. Thank you for your insight, your views on this program, and for all the efforts in rolling out the program in a timely manner. As Varun and Dr. Anuradha said, we just have maybe today or tomorrow we'll complete all the enrollments, and the program will be on. So thank you. And from here on, I would like to hand over the session to my colleague, Swati Saxena. Swati, over to you.
Thank you, Meeta, and thank you, Dr. Phanindra and Dr. Anuradha for that, and Varun for that wonderful discussion. So yes, we, Catalyst 2030 is all about collaboration, and we have seen the value of collaboration, especially in an intervention like this. And generally, taking the conversation forward on collaboration, I think in the social sector, there is a general consensus that NGOs should collaborate, but then there are reasons why that is not happening so frequently. And I'm going to take off from what Dr. Faninder said, that he said it's very interesting that, today in India, it's cheaper to, eat unhealthy food and, get your appetite satiated as compared to eating healthy food, because that takes more money and it also takes more time, so that the whole issue of time poverty when it comes to women also comes into fray. So from that perspective, what we're doing on NCDs is lifestyle management and behavior change, and that is especially very, very difficult. So that's why collaboration becomes so important, because it's very difficult for one NGO alone to do something like this. So we see the potential for impact. But I want to hear from both the panelists on, from Dr. Anuradha and Dr. Fanendra, that where do you see the way this collaboration has impacted, has influenced impact? Do you feel that this has added value to the programs and the services you're offering? And generally, just how does collaboration increase the impact we can deliver to the people that we serve?
Yeah, so in our case, unlike the experience from Jharkhand, ours is a completely free of cost hospital serving this part of the land, maybe to around 500 to 600 villages nearby. So as soon as we mentioned the name of the hospital, there was no doubt about any people, misguiding them for any of these digital scams or anything like that. And the biggest benefit that I saw amongst our frontline workers was we largely work on mother and child health initiatives. So our frontline workers came up with many ideas how we can expand and reach to our mothers and children with similar ideas in our own field. So I think this is something which was a big takeaway for me as a person at a personal level, and it was a big learnings.
Yes, Dr. Anuradha, I would love to hear your thoughts as well.
Yes. So, Swati, as I mentioned, we are working in many states, and we believe in partnerships. Not just one person alone can reach the scale. India is a huge country. So even though we work in many states, we do not have the expertise or even the strength, the human resources to work in all the, all over the country. So this is a wonderful example of how partnerships can realize a meaningful impact in helping people to lead healthy lifestyles. And like we are working in Jharkhand, and today it is great to hear the perspectives or how it is being rolled out in another part of the country, which is in Karnataka. So that gives us a more encouragement, or that gives us an insight to even take it up to other geographies where we are working in. And also we have other partners who are working with us, so we can enroll them or we can bring them on board to scale up such wonderful initiatives. So I would I think that having partnerships in enrolling and bringing synergies together is going to help all the stakeholders in the ecosystem.
Absolutely. And I think one of the things that, as we were just listening to the conversation that you were having, is that just sometimes the sheer value that comes from getting insights from different organizations that are working on similar projects but across different geographies. There's so much value to be had from there, and I think that itself is one of the power of collaboration, that you learn from what others are doing. And I think the second part that Dr. Faninder said, that learning from the ground, like the frontline health workers, if they're coming back with inputs on how they can use the same learnings for other programs, I'm sure they would have good insights on how we can also look at improving our program. And I'm sure our team would want to learn from that as well. So that's something, a phenomenal learning point. So we agree that there is need for collaboration. We all see the value, but like we have seen, it is difficult, right? And one challenge that we internally felt was that when it comes to us and everybody else in the ecosystem, is the question of will, right? Because you are overburdened, you're overstretched, you want to do so many things. So there's always that bandwidth issue. So we want to get your inputs as as very strong partners of ours, that what should Arogya World's approach be to get other health NGOs and non-health NGOs to collaborate? Where do you feel they would see value in it, and how should we reach out to them so that we are able to really leverage the kind of knowledge they have, the kind of trust they have in the communities that they have served, to reach our program and create impact amongst a greater population? I would love to hear from both panelists again. Yeah, Dr. Anuradha, would you like to go?
Yeah, so when Nalini spoke to me about this project, I mentioned to her that, it's not about the size or the commercials involved in the project. It's more about working together and also, understanding each other. These are like, what I have realized is that where we enter into one area and there are many opportunities that follow. After you do one, work together. So that is how we look at it as, expanding the partnerships, expanding the network, entering into new geographies together. So that is the approach that we have. And also even for Arogya World, if your values behind this project. I mean, the principles with which we work, that we want to create healthy societies, holistic well-being kind of a thing. I think that will appeal to a lot of people to join hands together and then come forward. I mean, there are like-minded organizations who are willing to work. And also the thing that when you enter one step into the ecosystem, like, now I got to know Satya Sai Hospital, and, tomorrow I want to do some work, I will approach him. And, likewise, if they want to do some work where we are working, we are going to be, using this network. So that is the power of networks and collaborative actions together. So that is the point that needs to be put across to the stakeholders in the ecosystem for them to come forward and join hands with you.
Yeah, no, absolutely. Nalini, you're on mute if you're saying something.
Thank you. I do want to bring in a couple more people, if I could, Swati, into the conversation, because this is fascinating. I am so excited by this entire session that we got to hear from the frontline, organizations, as well as people like us who are trying to build partnerships and in big coalitions. So there are two people in this group that I would like to hear from. Alex Counts is the head of the India Philanthropy Alliance, and he may have some perspectives of value to us. So I want to see what he has to say. And Dr. Joshua Chadwick from ICMR is also here, and he may have some perspectives as well. So Alex and Joshua, if you could comment, what advice would you give Arogya World as we try to build these on the ground collaborations to scale our programs at a minimum?
Well, all I'll say, I'm learning a lot, and I really salute everyone associated with Arogya, everyone who showed up today as part of Catalyzing Change Week, and all the great awards that Arogya has gotten. I just simply think that nonprofits tend to think in a kind of a bit of a myopia. They think about their impact, they think about what they're doing, their fundraising, and that's all important. But it sometimes you lose sight of the larger mission. And I think Arogya has done a terrific job of being very aggressive and unapologetic of trying to enroll organizations that complement its small footprint, but very powerful techniques to address NCDs, both within the India Philanthropy Alliance, within India Giving Day campaign that we just concluded in March. And I really think that there's a thought leadership opportunity for Arogya World to teach people in other sectors battling other diseases or battling other issues other than health, of how an organization can punch above its weight, and excuse the boxing analogy. But I really think that you all are onto something important and have a lot of things to teach people in adjacent sectors and movements.
Thank you. Thank you very much for that, Alex, because really, truly, there is so much wealth within organizations and the infrastructures and the reach they already have. If we just collaborate, piggybacking on other people's efforts like the ones going on, the one we described right now, both in Jharkhand and in Karnataka, it's a little extra work for them, but not a lot. But the value of it is 2,600 more people got important health information. So for us, that's the bigger picture is what we have to sell, if you want to call it that, to other NGOs. But it is difficult. There's no doubt about it. Both ISAP Foundation and Satya Sai College took this on as extra work. This was extra for them, and yes, extra for us as well. But it is, it's meeting all our objectives, and especially, it's advancing a very important element of our scale-up plan. So for us, selfishly, from Arogya's perspective, this is very important. Dr. Joshua, I just wanted to get your thoughts, if you're still there, on what we should be doing going forward.
Thank you, Dr. Nalini, for calling her my name. I did not expect that. Anyway, Indian Council of Medical Research.
Dr. Joshua, maybe you could switch off your video. We can't hear you. Yes, thank you.
Okay. Oh, yeah. So we are delighted to have the collaboration with you, Dr. Nalini, and we want to have the effectiveness data first. And so that's why we're planning to implement this ML strategy in Punjab and Tamil Nadu, where these two states have the highest prevalence of diabetes. We are having this, whatever you have developed, this ML, the content, which is primarily to prevent diabetes. We are just trying to tweak it and contextualize, and trying to utilize it for control of diabetes. Then I'm looking forward for a day where we can scale it up across the country. And I hope the national program for the NCDs, the program for diabetes, cancer and stroke, will observe the ML strategy altogether. I'm looking forward for the day, and we are. Thank you for inviting me to this talk, and I'm happy to listen to this important talk. Thank you.
Thank you. Swati, sorry to have interrupted. Back
No
to
problem.
you.
Over to you, Nalini.
Yeah. So, yeah, great. So thank you. And we are very, excited about the partnership. So, I mean, if you look at the kind of partnerships Arogya World has here, we have very strong, solid implementation partners from whom we are learning, with whom we are sharing our program. And then we are collaborating with ICMR to just make our evidence base extremely, strong, and then look at ways in which we can scale up. So I have one question, Alex, and I would love to hear your thoughts first on that. That, when we look at the whole sector, we look at funding, right? And funding is always that one, barrier and one challenge when we look at anything to do with the social sector. And of course, when you look at collaboration, that also becomes a challenge because, everything needs money. Whether it's message transmission, or whether it's training, whether it's impact assessment, project management. So when NGOs look at, and in a small way you can do with less, right? But when you look at scaling it up and you look at really creating a large impact at scale, how should NGOs look at collaboration from a funding lens? Would love to hear your thoughts on that. And then anybody else from the panelists and in the audience would love to hear your thoughts as well on this.
Well, I think that, funders are all over the map in their levels of sophistication, how much they're paying attention to current trends. So you can't characterize funders in any way. But I think that, I have an article coming out in Inside Philanthropy where I talk about good practices in donating and being a donor. And we were just talking in our IPA retreat that Nalini was part of, about, kind of educating donors, which is a little bit fraught because here are very successful, wealthy people and you want to educate them and maybe they don't want to be educated or they don't think they need to be educated. But, I think a philanthropy 1.0 is about funding projects. where people want to fund a certain thing, and they actually see the implementer as kind of as, you know, they want the implementer to basically be, you know, get as little out of it as possible because they want the efficiency of the project. And so they want to kind of turn the screws on the implementer to spend as least as possible to get the most result. And you can kind of see the logic of it, but then I think the kind of 2.0, as I sometimes call it, is about people investing in the institution. They're not a project. Projects come and go with institutions, but you're really trying to build an organization that's there to last, to address today's problems, but to learn from today's problems to address tomorrow's problems that might not even exist today. If diabetes gets under control in India, but there may be a new generation of problems that come from that, solving that one, that we don't even know what they're going to be yet. But if you build an institution, it's there. And I think to educate donors who are willing to be educated about the power of building an institution rather than funding a project, that's very powerful. And then I think the 3.0 version is about not just building individual institutions that operate in isolation, but building coalitions, or what in a very famous article, maybe I'll put it in the chat, around collective impact as an alternative to isolated impact. Because, you know, organizations work in an ecosystem, and their impact, while they try to figure out exactly what their impact is, it's almost impossible because so many other factors, including other nonprofits that could be collaborators. And so to kind of get donors in that mindset of thinking that, you know, that collective impact, that kind of third generation is powerful, and it's more powerful than just the project. It's even more powerful often than just the institution, as important as that is. And ultimately, whenever you're trying to convince something of someone, I think it's what you're trying to do is you want them to come out of the experience thinking it was their idea in the first place. So how can you kind of lead people down and lay the breadcrumbs so that the donor says, of course, collective impact, I've been saying that for years, let's fund that. And you know, that's the kind of the secret there that I don't say that I'm an expert on, but sometimes it's worked out. And again, there's a lot of talk about this in philanthropy. Mackenzie Scott has been paving some roads, some, you know, and so forth. But sometimes the action, old habits about thinking more at the project level or the institutional level override rhetoric. And so it's just about reminding people what they're saying or thinking or should be saying or should be thinking. But it's, you know, it's play the long game. You know, sometimes people, when they go from non-philanthropic to philanthropic, they start at the project level. So you got to kind of meet them where they are, but think about you know, what might be a 5-year strategy to get them to think more at that second or third level, and do great projects if that's all they're willing to support, but start laying the groundwork, laying the breadcrumbs for going to those other levels. That's the best I can come up with.
Sure. No, that's really great insight, Alex. And you know, coming from the sector and having spent so many years in fundraising, my personal greatest wish for the sector is that for philanthropy is that we should move absolutely to trust-based philanthropy, and trust amongst organizations, trust amongst partners, trust among collaborators, because we're all here for the mission. We're not here for anything else. So on that note, I would just open this up to anybody who has a comment, question, inputs, and then Nalini, over to you for any last comments and views. But thank you very much to all the panelists for your wonderful discussions and inputs.
Yeah, could I just wanted to make a small comment, if that's okay, Swati?
Yeah, sure. Go ahead.
Yeah, hi. So I was just, Alex, fabulous listening to you and the other side of the table view, the funders or the philanthropists view. You know, I just picking up from where you left, I've always kind of believed, and I thought you were kind of leading to that I believe the donors or grantees or philanthropists, and now we call them it's getting more intelligent, and investors and impact investors, because they do know all the players who are trying to make impact on the SDG in their respective SDG boxes. So I just was wondering, where is the donor or / whatever names community at when they look at the last SDG, which is 17, in partnerships? And because I think there is a lot of influence and collective wisdom that the donor community or the investor community could have to bring all these individual mission people together. So I kind of sometimes call it convergence inside out, because when you converge people, you kind of bring them forcibly, so to say, kind of together. You do health, you do education, and then it kind of very often than not fails. But inside out, something like, where the donor community actually, and if you want to call it 4.0, becomes a stakeholder in the social impact, saying that, fine, SDG has kind of divided us all, but it has kind of structured it, and there are these 16 boxes, and fine, I have 5 organizations which are doing climate, or other donors are funding solar, whatever, but let's all come together at least, for some time, and see where is everybody at. Because as I was listening to diabetes, and I've been associated with Arogya World for about 3+ years now, but I was thinking that, hey, if all the teachers, if the education department, when the enrollments happen, why can't they just kind of enroll them in the preventive messages? So a typical education department won't think of doing that. But from a donor, I think that consciousness the donor community can bring to improve the return on investment, and just not in depth, but also in breadth, wherein. So just wanted to, I was just thinking, and I thought I'd just put it out there, and was curious about what are the other missed opportunities amongst the various donors talked about, or being looked at, should be looked at. So I don't know if you want to comment or reflect. It was just going through my head, and I just blurted it out. So over to you, Alex, or Swati. Yeah.
Well, let me just say briefly, I think that, first of all, nonprofits have a lot of work to do, and a lot of them hold their donors at kind of arm's length, don't treat them as full partners, or as one of my board chairs a long time ago said, nonprofits, when you really get down to business, they treat me like a human ATM, not someone who can help them and who's had success in business that might translate into the mission. And so I think that's very important. I also think that, at least my personal experience, I've not done any serious research on this, that donor-driven collaboration among nonprofits usually doesn't work. If the nonprofits aren't ready to collaborate, if they don't have someone like Nalini who's kind of ringing the bell and saying, we need to get our act together and work together, if the donors are the orchestrating of it, it'll fall apart the minute the donations stop. However, and I do make this point in my Inside Philanthropy article that I wish was out, is that when collaborations organically happen within nonprofits, donors, I think, should move very quickly to back it, because then it's coming from the bottom up. But if it tries to come from the top down, I'm sure there are examples that have worked out, but my general sense is that it's the nonprofits are just doing what the donors think they want to do, but their heart really isn't in it. But again, that may not be the case in every instance, but I think it's the dominant case.
So I think we've taken up more than the hour we had thought we could end this conversation, but it's been a fascinating conversation, and I'm really grateful to everybody, for bringing your whole selves to this meeting, because we learned so much. I learned so much from Dr. Anuradha and Dr. Phanindra. We didn't hear from Mr. Ashimavo, but it would have been nice if we'd had some more time to hear from you as well, and from Varun and Meeta and Swati. This has been a fascinating conversation, and Smriti, and Alex and Joshua. So it's been a fascinating conversation, and I learned a lot. there is a Prashant in the audience. Please do reach out. I would love to talk to you about how to influence education NGOs to join this health efforts and vice versa. So please do reach out to me. I'm Nalini at arogyaworld.org. Okay, and we'll talk because it is important. I do want to end this conversation by saying that, hey, you know, reinforcing for me always is that we must partner and take credible partners with us into the community. If we can go with credible partners like ISAP Foundation and Satya Sai College, yeah, the recruitment happens. Like Arvind, like LV Prasad, you know, recruitment happens. Like Nokia. So if you go with trusted names, you know, people are less afraid of the program that you are bringing to them. So that this again today that came you know, front and center for me. The second point I wanted to make is that, you know, today's project was work in progress. Recruitment has just started. The 6 months of text messages are going to happen. WhatsApp messages are going to happen now, from now for the next 6 months. We don't even know what is the impact evaluation. So almost, you know, that is secondary. What we focused on was the collaboration and was the willingness of 3 people who didn't know each other to partner on a project thanks to this Catalyst 2030 community and, you know, the modest funding we got. I didn't know Dr. Anuradha, didn't know Mr. Ashimavo. We just reached out and yeah, they joined hands, sure. The first answer, no, it was not a no, it was sure. Let's do it. So when that let's do it attitude is there, you know, a lot can happen. So I am so excited, you know, for the future of this kind of thinking and collaboration, because I do think we can, you know, make things better for India. So much is at stake. India is young, you know, median age is 27 years old. Age of 27. So half the country is below 27, half the country is above 27. Those 27-year-olds, when they become 30, they're going to get diabetes. They're going to be sick for the rest of their lives. We need to prevent diabetes for that half of India, you know, where we can play a role. And if we do that, the future of India, you know, it's already the most populous nation. It's already the one climbing out from lower middle income country to middle income country. Its future to have a very healthy, productive workforce. You go into these startup conversations and it's so exciting to see how much technology advancement is happening in India. But all those technology advances will be negated completely unless we can do something to really tackle what I think is the defining health challenge of my generation, which is this non-communicable disease. Today, we showed one pathway for on-the-ground collaborations, and we'll be building on that at Arogya. And really thank Catalyst 2030 for the funding support. Thank both ISAP Foundation and Satya Sai College for joining us, you know, and to all the Arogya team and to everybody here. Really excited about the future of, you know, what we can do if we join hands all together. Thank you. Thanks very much.
Thanks, everyone. Good night.
Thank you. Thank you, Nalini. Thanks, Arogya.